Hello and welcome to Health Talk. I'm Dr. Manny. All too often, we pop a pill to get relief from chronic pain, and that will work. But it can also lead to addiction in the long run, something my next guest has seen too often. Joining me now is Dr. Mel Pohl. He's the medical director at Las Vegas Recovery Center and the author of the Pain Antidote, the proven plan to help you stop suffering from chronic pain, avoid addiction to painkillers, and reclaim your life. Welcome, Doc. Very timely book, The Pain Antidote. And I think, the question that I want to ask you, what is the problem nowadays with this, the statistics that we see with addiction to painkillers?
Well, probably everything's an estimate, but about 15 million people take a pain medicine every day, 15 million Americans. About 2 million of them have some sort of dependence or misuse of the drug. So it's a huge problem. 16,000 people are dying every year, more than motor vehicle accidents from overdosing on these drugs.
Back in 2000, I remember, the Joint Commission came out very strongly to make pain the fifth vital sign. And from that point on, we were instructed and told that if we did not pay attention to pain in the hospital and we were not servicing patients, we were going to get into trouble. And it seems to me that among many other things, is sort of the genesis of the problem, where doctors said, okay, I have to prescribe a lot of, opioids, pill form. What do you think about that?
Well, I think the mistake that the Joint Commission and the medical profession, in essence, made was to think that the proper solution for pain is medication necessarily.
Right.
And really, we're talking about chronic pain, which is different than what happens in a post-op patient.
Right. And one of the things that you mention in your book is you have to accept your pain a little bit, right?
I think so. I mean, I think we can fight against it and make it go away and be miserable because we have it, or we can say, look, I woke up today with my back hurting and my thumb hurting from arthritis.
You're not going to run and start taking pills.
No, not opioids for me.
Exactly, right. I think a lot of patients, acceptance is one of them. In your book, you talk about, listen, look at pain from a different angle and start developing strategies. Let's talk about some of the strategies, because I think people are looking for, okay, give me some recipe how to deal with my pain.
And that's what we try and do in hundreds of pages in the book. But short answer, you have to move. Even though it hurts to move, you have to move. Exercise in a graded manner is really key.
Right.
Nutrition is important, what you put in your body. Exercise in whatever form you can manage. And then we spend a lot of time talking about thinking, how we can change our thoughts through meditation, breathing exercises, and really effectively learning to allow the process of pain to be a part of my life and not be overwhelmed by it.
The lack of, or the improper nutrition leads to inflammation, right? So talk to me a little bit about food.
Well, we know that there are some foods that tend to decrease inflammation, starting simply with water. Properly hydrating the cells and the joint spaces improves circulation and gets rid of toxins. But we also have some beneficial foods. Certain fruits, cranberries, blueberries, cherries have chemicals that cause a decrease in inflammation.
Right.
Certain green vegetables. I'm not a fan of kale, but it really seems to help decrease inflammation. Walnuts tend to decrease inflammation, and some vitamins like vitamin D also decrease inflammation. I'll mention toxins, things that are bad for the body.
Right.
Preservatives, artificial sweeteners, hydrogenated oils, and charred foods seem to do the opposite.
In regards to foods, again, alcohol. A lot of people make the mistake and they said, oh, my knee is hurting, but you know what, I'm going to take a shot of vodka and now I start feeling better. But you're fooling yourself when it comes to alcohol pain relief.
It's very similar to opioids. You temporarily take the pain down, numb the system, but in the long run, you have a reflex inflammation, especially from alcohol, very inflammatory.
Again, you're one of the leading national authorities on pain. You had patients get off pills?
Yeah, we run a treatment center in Las Vegas where we admit people on very high doses of opioids, crazy high doses.
Right.
We take them off their opioids, and what they find is they have less pain off the medicine than on the medicine, because the medicine seems to drive the pain level up. The data, Dr. Manny, says that opioids aren't working in most people who take them longer than 3 months.
Right. So if if you're taking, let's say, Vicodin, and you're going, months after months after months, basically you're making yourself a chemical addict, but you're still not dealing with the whole issue of your pain.
Yes, chemically dependent, needing. One of the reasons the pain goes up is that people are dependent.
Right.
So between doses, they have an increase in pain. It's hard to fathom that you'd be better off without the meds, but that's the truth of our experience.
All right. Well, I think everybody should get this book. Where can people get it?
Certainly on Amazon. We have a website, thepainantidote.com.
Thank you so much for coming.
Thank you.
And if you have any health questions, send them here at Fox, at drmanny@foxnews.com. Until next time, I'm Dr. Manny.